So I'm at the National Institute on Drug Abuse, and I guess I follow the academic model. As someone mentioned earlier, I'm just going to highlight the things that I'm going to touch on. Many of the things that I want to talk about have already been mentioned, and I think that's actually a good thing. So I won't go through all the details on my slide. I may just highlight some things, and I suspect that the slides will be available at a later time. So I want to talk a little bit about HIV research and NIDA, talk about some of our priorities, talk about some of our HIV initiatives, talk about some of the funding opportunities for HIV research in general, and also for HIV research that includes a focus on technology, and then talk a little bit about some of the questions, challenges, and considerations as well as opportunities. And again, some of these things have already come up. This is just a picture here of the different institutes at NIH. There are 27 institutes, and NIDA, the National Institute on Drug Abuse, and also NIMH are in the right-hand corner there. So that's where we are, just to give you a sense of NIH. So at NIDA, our interest in HIV is that we're interested in drug-related HIV/AIDS, and that's important to us. We recognize that substance use is a major factor with respect to HIV/AIDS in terms of a number of things. As you all know, substance use is associated with increased risk behaviors, including injecting drug use and substance use, which is related to contracting and transmitting HIV/AIDS. Drug use affects pharmacological and physiological processes such as stress and immune function. Also, drug use can alter risk-taking and decision-making in terms of brain functioning, and that was mentioned earlier. So there are a number of reasons why we're interested in HIV/AIDS and also the role of substance use in HIV/AIDS. So it definitely is a priority for us. Just want to highlight the mission for our institute is that we attempt to lead the nation in bringing the power of science to bear on drug abuse and addiction, and there are two critical components to that. One is a focus on strategic support and conduct of research across a broad range of disciplines, and the importance of that has been highlighted today in terms of the need to collaborate and work across disciplines, and then also ensuring the rapid and effective dissemination and use of results from research. So we're very interested in not just supporting research for the sake of research, but looking at how do we take those results from research into practice, into the community, to also have an impact on policy. Here's a list of NIDA's HIV/AIDS priorities, and they are on the NIDA's website, so you can go ahead and take a look. I just want to highlight a couple that I think are very relevant to what we've been talking about today. One is preventing the acquisition and transmission of HIV/AIDS among drug abusers and their partners, decreasing health disparities, and improving treatment and outcomes of drug abusers through a better understanding of interactions and the HIV/AIDS processes and the medications used to treat both. Some of our HIV/AIDS research priorities that I want to highlight, again, a focus on reducing health disparities. Seek, test, treat, and retain is an area, an initiative that has been very important to us and important to NIDA, and this actually has been mentioned in a number of different talks. That is, seeking out and identifying populations that are at risk for HIV/AIDS, testing them, as has already been discussed today, getting individuals into treatment, and retaining them in care. And we talked about the challenges associated with that. Drug treatment as prevention. NIDA research has provided evidence that drug treatment can serve as a form of HIV prevention, so drug treatment is important. And then also interventions that target at-risk populations, such as individuals in the criminal justice systems, injecting drug users, and other at-risk populations. And then we have also some international priorities that are listed there, and I won't go through them. I'm going to skip this, but I just want to mention that at NIDA, I'm in the Division of Epidemiology Services and Prevention Research. So we support epidemiology research, which looks at the distribution of substance use problems and drug-related HIV/AIDS, and also looking at trends and patterns. We support services treatment research, which is focused on getting interventions into treatment practice settings, focus on organization, cost factors, and I'm in the prevention research branch, so where we focus on preventing the initiation of drug use to the escalation of drug use to problem drug use and dependence, and also drug-related HIV/AIDS. but I do want to mention some of the initiatives that, some of the HIV/AIDS initiatives within our division. So again, one important initiative to our division and to NIH in general is what I talked about in Seek, Test, Treat, and Retain. And we've actually had two special, what are called requests for applications that have focused on this Seek, Test, Treat, and Retain initiative. One focusing on individuals in the criminal justice system, and the second focusing on vulnerable populations. We have a current initiative that is called JJ Trials, which is focused on juvenile justice systems. It's focused on translating research findings, so translating findings about evidence-based interventions into juvenile justice settings. And then we also have an emphasis and an interest on what just came up in the last panel, is looking at healthcare reform, looking at getting drug use prevention, addiction treatment, and HIV care services into healthcare settings and considerations within healthcare reform. We had 4 requests for applications that have just expired, but I included these here because this was part of a multi-pronged initiative to focus on vulnerable and at-risk populations. So it was focused on homeless populations, focused on African American women and young MSM, focused on prevention and treatment within HIV/AIDS service delivery settings, and also looking at comorbid HIV, chronic pain, and substance use among older adults. And I put this up here because although the RFA has expired, I just wanted to highlight that these are areas that are of interest and that are a priority for our institute. So even though the RFA is no longer out there, the deadline has passed, it is something that we're still interested in. Technology research, we're interested in HIV and technology research. These are a number of the technologies that we're interested in. Again, I'm behind the times, so you have talked about some technologies that go way above and beyond this. Just want to mention that our director in particular is interested in looking at gaming and video games that can be used for prevention. And I have listed here a number of funding opportunity announcements, program announcements that are related to HIV/AIDS and HIV/AIDS research, and I've highlighted the ones that I think are most relevant to what we've been talking about here today. So the first one is AIDS Science Track Award for Research Transition. How many early career researchers do we have in the room? Okay, all right. But before I go on, I want to say that one of the things I really liked about this conference is the diversity of the participants and also the presenters, and that we've had researchers, we've had community service providers, we've had people from the business sector, we've had community members, so I think that has been what has been so enriching for this conference for me. So the AIDS Science Track Award is really a mechanism for early investigators who want to focus on integrating a focus on substance use and HIV/AIDS. So they might be doing substance use research and want to integrate the HIV/AIDS focus, or they might be doing HIV/AIDS research and want to integrate the substance use focus. Development and testing of novel interventions to improve HIV prevention, care, and program implementation. And some of these I think, Susanna, you had on your slide as well, so I'll try not to repeat. Pilot and feasibility studies in preparation for drug and alcohol abuse prevention trials. This is a great mechanism for early investigators, or if you don't have pilot data. As Susanna mentioned at NIH, we do have this model of developing feasibility data, pilot data, testing for efficacy, testing for effectiveness, and then implementation. So if you're applying for a larger grant such as an R01, it is important to have feasibility and pilot data, and this is an excellent mechanism to do that. Drug abuse aspects of HIV/AIDS, which provides an opportunity to do HIV and technology research, and then the INO, which I think Susanna mentioned. And the one that's highlighted in purple there is one that is very specific to HIV/AIDS and technology. So that's technology-based interventions to promote engagement in care and treatment adherence for substance abusing populations with HIV/AIDS. I also want to mention our SBIR and STTR mechanism, which I think is relevant because we do have people from the business sector here. SBIR is Small Business Innovation Research, and STTR is Small Business Technology Transfer Research. And those mechanisms, or those grant opportunities, are for businesses. So SBIR is for businesses who want to get support to do innovation development and testing, or technology development and testing, and STTR are for businesses who will be partnering with an academic research institution. So those are excellent mechanisms if you're a business or if you're a person in a research institution that wants to partner with a business for development of technology or innovation. A couple of challenges that have already been mentioned. I just want to highlight a couple. One is, do technology interventions have the same effects as interventions that are delivered in person? What are the limitations of technology? Which kind of came up. I think it's something that we need to think about. This came up in, I think it was Ian's panel, and actually I think Ian, you mentioned it, in terms of when are in-person interventions and interactions necessary? Is it best to just deliver technology interventions? When do we need to have in-person interactions? Already mentioned how to keep current and or ahead of evolving technologies. I've seen in the past that a person has a 5-year grant and they develop their technology, and by the time the study's over, then that technology has passed, we're onto something new. So how do we develop interventions that are adaptable to evolving technology? Issues around feasibility, acceptability, efficacy, and effectiveness, and best practices for adaptation of effective interventions for dissemination and implementation using new technologies, and what parts of interventions should be adapted and can be adapted, and what are the processes for doing that. Advantages we've already talked about. A couple of considerations that I want to mention is that the use of technology can be patients and it can be providers, so I think we've touched on that, and also key family or social supports, and emphasizing the need for collaboration among researchers. And I just want to mention this, some of you may already be familiar with this. There was a special issue in AIDS research and treatment, and a number of the studies that were funded by NIDA and the HIV and technology RFA that I mentioned were, there were articles on those studies in this special issue. Very preliminary findings. And there were a couple of things that were mentioned in the editorial by Kirk et al. That I thought were very relevant to this meeting that I just kind of wanted to highlight. So future directions were identified as the development of theoretical frameworks, refinement of real-time data collection and analysis, identification of best methods for delivering context-specific interventions, maintaining confidentiality, which came up in the last panel, determining effectiveness, and then the challenges, and which have already been mentioned. So summary and final comments is that technology research for HIV prevention and care, with respect to substance using and abusing populations, it's really a developing area for us. It's definitely an area that is of interest to our institute. It is a priority for our institute. There are funding opportunities that are available. I highlighted them there. Again, you will have the handouts, and you can go to our website to get information on them. And then also, if you're interested in applying for funding to integrate HIV and technology research, I would definitely encourage you to reach out to NIDA program staff. NIDA program staff are there to help you in terms of, is this a topic that is of interest to us? What are the funding opportunities that might be most relevant to what it is that you're trying to do? And then also, we're available to help you in terms of developing your concept, helping you to look at your aims, and to help you identify what's the best review panel for your application.